Hello, everybody. Jennifer Fleming here from the Alchemy Clinic. Welcome to the Alchemy Exchange. And today we are going to talk about the very important and often taboo subject of sexual wellness. So what is sexual wellness anyway? Many people might have a different sort of definition for this, but I feel that sexual wellness is our emotional, our mental, our social well-being as it relates to our sexuality. And if we move that a step closer with regards to how we view this in medicine, or how do we enhance this with regards to our overall sexual health, is what can we do? What are tools and procedures that we can do to enhance this type of experience? And in regenerative medicine, we can use things like PRP, or platelet-rich plasma. And platelet-rich plasma, all this is that we are taking a blood sample from a patient, we are spinning this down, and we are able to collect a moderate, or the goal is that we are collecting millions of growth factors from a collection of plasma. And we are then able to inject that plasma back into specific areas of tissues for both men and women. So for women, we would be injecting this into the anterior wall of the vagina, also known as the G-spot. And we would also be injecting this into the clitoris. And I know that this, for many people listening, might sound a little bit scary. It's not, because you are numb for this procedure. So first and foremost, you don't have to worry about having, I think it's actually more for many of our patients, that initial procedure is just more of the unknown, of that little bit of fear associated with this. So we do our best to just take that fear out of this, because this should not be a fearful experience. And then for men, we're injecting it along the shaft and in the glands of the penis, which tends to be, a female is the clitoris, tends to be the most sensitive area. And for a men, it is the glands of the penis. And so we are injecting this in specific areas, because the whole goal of this is that we are utilizing the patient's your own growth factors to enhance that tissue. So how does this work? So PRP does something, it utilizes a term also known as angiogenesis. So what does this mean? When we are born, we have our pathway of blood vessels and nerve endings, and it's sort of like our own network. But over time, there are things that, whether it just be with age, whether it be with anatomical reasons why we're unable to maybe achieve orgasm, or we just don't have as much sensitivity as other patients might have. Some patients might have underlying medical problems such as high blood pressure, high cholesterol, diabetes, and especially this is common for both men and women, but for men that are struggling with erectile dysfunction, my mind is always going to making sure that we're identifying other organic reasons why patients may be having some of these issues. Because PRP injections are wonderful and they can do great things, but we also want to ensure that we are thinking about some of those other organic reasons, because we need to pay attention to that. If there is blood pressure that we need to treat, we need to do that. If it's cholesterol, if we have to better manage your diabetes, if we have to come up with another plan to sort of manage all of those other things, we have to do that, and that's great. And PRP may very well be a good option for you, but there might be things that we might want to optimize first in your plan of care, if you will. Remember, too, in that we are utilizing PRP from that specific patient. So the healthier the patient is, the better the sample of your PRP. That's just ultimately, that's just the name of the game. The healthier we are, the better our sample is going to be. So if we can improve our overall health prior to even getting some of these injections, you're just going to have a better response and outcome. So we have really been using PRP for a long time. PRP initially started in dentistry when we were using this to help to heal sockets from teeth that were pulled and for different procedures. Then PRP, the history of PRP, it sort of extended into orthopedics, which we still use to this day, into hair restoration, and then into more of that sexual wellness. And then, of course, we use that for other aesthetic purposes as well to help rejuvenate and enhance our tissue, whether we're using this for microneedling or with other procedures. It's very helpful. But with regards to sexual wellness, I usually will say that patients, if in fact there is no underlying organic reasons and a patient is just doing this because they are, maybe it's being more proactive, they are just looking for maybe a little bit of further enhancement, then you might do great with one procedure. For other patients that might have underlying organic reasons, or maybe you've been struggling with some issues for a long time, it's not uncommon for patients to require a series of them. I tend to think of it as you're trying to rebuild that foundation, and then the whole goal is you're maintaining that foundation along the way. So if you do great with one treatment, fantastic, you don't need any more. But if you don't quite have the results after your first treatment, that does not mean that this is treatment failure. It just means that we just need to continue to build that foundation to get you the results in which you are trying to achieve. I am also a stickler for all PRP is not created the same. So it is based off of what machine you're using, how many platelets you're able to extract. Are you using are you manipulating that blood in any way? And so we use here at the Alchemy Clinic, we use a pretty robust system because I want to ensure that I have the biggest sample possible. So for a male, we are going to take a pretty big sample size. It's usually 120 cc's of blood, which is a lot. And then we're spinning that down, and out of that 120 cc's, we're only using about 10 to 14 cc's. So remember, it's not the quantity, it's the concentration of that product in which you are then going to inject back into the patient. And for females, we're using a sample size of about 60 mLs because we're just injecting a smaller quantity. So we can still, out of that 60, really concentrate down to about 10 to 12 cc's in that total sample size for that treatment. So it's important to ask questions, ask the provider what type of sample they're using. Is there any gel in the tubes? Because if there are gel in the tubes of that PRP, oftentimes those growth factors they can get stuck in that gel tubing. And the reason why people might be using that is because they're a cheaper sample and they are a cheaper tube and process, but this is your outcome. We want the best sample for you. So ask the appropriate questions. And what I will say to many of our patients is, unfortunately, the data for the O shot or the P shot or for using PRP for sexual wellness, it is a lot of anecdotal research because there's just not a whole lot of money that researchers are going to spend with regards to putting electrodes and really trying to identify in an objective way. We're not going to be doing a double-blind study. This is really just, does a patient get results and what their results were? It is just more of how a patient feels. That's the data in which we have obtained thus far. We've been doing this for years, and here in the clinic, we have also been injecting patients for years now. And what I can say is that people would not be coming back, and we would not be doing these procedures on a weekly basis if people were not getting the results that they want. So again, if we take a holistic approach, this doesn't mean for some men, for instance, for patients with erectile dysfunction, we might get improvement in that if people are already on medications such as Viagra or Cialis. The hope is that we might need less of those medications, but that doesn't mean that a P-shot might, halt, or we might never need or require those things. Because remember, oftentimes there might be some underlying organic reasons why we are requiring those medications to begin with. So these are conversations that we have. If you are interested in these type of procedures or you have any other questions, please feel free to reach out to us, send us some comments below. And remember, sexual wellness should not be a topic that is taboo. It is very important to our overall physical and mental and social health on a day-to-day basis. This is how we connect to our loved ones. And so if there are areas that we can enhance to help with that type of experience, then we want to be able to offer that to our patients. So remember, we are here if you have any questions, and I hope that this was helpful.